Hello, everyone. Warm good evening to all our esteemed guests and dignitaries on the dais. Today, it's a wonderful Sunday, first week of July and first Sunday of July, and we are here to talk about a very interesting topic on integrating pharmacotherapy in tobacco cessation. Now, we move towards a scientific session. I'm happy to introduce to all our audience the moderator for the evening, Dr. Nandita Deveka. She is a consultant in anesthesia and critical care at Medway NHS Trust in UK. She's a lead for smoking cessation in her hospital and very passionate about the cause. She was pivotal in starting the STOP, the Stop Before the Op clinic. She and her two colleagues were awarded the CEO Award for Brilliance to study the Ottawa model, and recently she had been invited to talk about her experiences at the National Smoking Cessation and Health Conference in UK about the smoking cessation modalities. I invite ma'am to kindly take the session ahead.
Thank you, Shruti. Namaste to everyone and welcome and greetings from the UK. How true, isn't it? The world has the same problem, and WHO has described tobacco as the only legal drug that kills many of its users when used exactly as intended by the manufacturers. And if you think, oh, India is different and UK is different, no, we have the same problems, and COVID has actually made it worse sometimes because many people committed to quit, but at the same time, there have been many additional smokers. Thank you very much, Dr. Pawan Gupta, Dr. Reena, Kumar, Dr. Desai, and all the dignitaries, and of course, Shruti, for inviting me to this prestigious conference and giving me the opportunity to be a moderator for this session and then come to a conclusion at the end. So I really hope that this E-Conclave is really very successful and we can take it internationally as well.
Thank you. And I think something very interesting is coming up, and that is the quiz, right? So we have still got 220 people on watching us on the Zoom. So we will be having the quiz, and the quiz is being conducted by none other but with Dr. Nandita's son, Omkaar Divekar. So over for the quiz. And before the quiz, let me ask everyone to please join it will just take 1 minute, but please join our Facebook page, because that is where we will be having a lot of our details and more details about the program. So I'm just putting the Facebook page link. I will request everyone who is here on watching us on the Zoom or YouTube or wherever, please join us on the Facebook page. I will just give 3 minutes and every one of you can join groups. The results and all the details of whatever we are having, all the will be put on this Facebook page. So this is a community page, and request everyone to join, and just put here join. Once you have joined, just put here JOIND. So it will be a great thing to have you all on our page. And just to let you know, we have a quit line number also for those who have still not been able to start the quit tobacco cessation program in their hospital. So we can help you out with this quit line number, and we have started having virtual clinics for tobacco cessation. So this would be really encouraging for every one of you to ask your patients to quit tobacco, and they can at least get a proper guidance from the whole system that we have set at ICanCaRe. So I think, yeah, quite a...
The number, or is it on the group?
Yeah, it is the number is 011 430 77695.
Can you put it in the chat box?
Yes, I just put it there.
Thank you.
So this number, we have got virtual tobacco cessation program. We have got a training program, and Dr. Reena is the academic director for this training program that we are giving to all across all the specialty, whether it is dental, onco, cardiac, pulmonary, every specialties we are trying to train so that they can incorporate this tobacco cessation in their routine practice. So this is a very important thing that so I think, thank you so much, and I think we will go ahead. We have at 6:20 p.m. so we will have 10 minutes of quiz, and over to you, Omkar, for the quiz. So yeah, Omkar. Over to you.
Thank you, Dr. Gupta. So yeah, just a small introduction for myself. My name's Omkar, as was previously mentioned. I'm going into my 4th year of medical school at St. George's in London. And yeah, I'm just going to be hosting the quiz. So what I'll do is I will post the link to the quiz in the chat box just now. And 2 seconds. If everybody here, I see there are 210 people here. If everybody could go onto that link. Sorry, I posted it direct.
Yeah, that's the link is there in the chat box.
Yeah, the link is now there in the chat box. If everybody could go to that link, and all that you'll need to do is put in your name and put in your email, and in 2 minutes time, so that people can go on it, I will set a timer for 10 minutes. And as was mentioned before, there'll be prizes for the people with the highest score and who submit it the quickest. So there's 20 multiple choice questions and you'll have 10 minutes to do it. So as I said, there's the link has been posted into the chat. If everybody could go onto it, that would be great. And in I'll give it another 30 or 45 seconds for everybody to go on, and then I'll set a timer for 10 minutes. And thanks, Shruti. I will go through the questions as well, but people who are answering don't have to stay in time with me. You can fill it out as quickly as you want, as quickly as possible. I'll just be going through the questions as well.
So we've disabled the chat box so that nobody can type in the answers. And if Nimesh sir and Pawan sir say yes and go ahead, so we'll begin with the questions here on the dais.
Okay, so
yeah, if everyone is ready, then let's go ahead.
Yeah, so I'll start my timer for 10 minutes right now. So Shruti, if you could just go through the questions. Yeah, so the first question is, unaided quitting efforts fail in almost how much % of smokers? 4 answers, multiple choice. Only one of them is correct in all of the questions. So the first answer is 45, 75, 95, or 85% of smokers. So that's question 1. So question 2, varenicline binds to the nicotinic receptor and partially stimulates what release? So answer A is nicotine, B is dopamine, C is serotonin, or D is all of the above. Question 3, varenicline action is mainly due to binding to which receptors? I became muted there, sorry. I'll read the question out again. Varenicline action is mainly due to the binding to which receptors? Answer A is alpha-4 beta-2, B is alpha-2 beta-2, C is alpha-2 beta-4, and then answer D is alpha-4 beta-4, or E is all of the above. Question 4. A double-blind randomized placebo-controlled and active-controlled clinical trial to study the neuropsychiatric effects and efficacy of varenicline bupropion and nicotine patch is called A, a hawk study, B, an eagle study, C, a bat study, or D, a parrot study. Question 5. Bupropion is A, a GABA receptor inhibitor, B, a central nervous system depressant, C, norepinephrine or dopamine reuptake inhibitor, or D, a nicotine receptor antagonist? 7.5 minutes remaining on the quiz. Question 6. The starting dose of varenicline is A, 0.5 milligrams twice daily for days 1 to 3, B, 0.5 once daily for days 1 to 3, or C, 1 milligram twice daily for days 1 to 3. Question 7, the Save the Youth campaign. Save denotes A, suspension, arrogance, violent end, B, suspect, adhere, volunteer end, C, sensitize, assist, volunteer, enforce, or D, strike, act, volunteer, end. Question 8. So put the 5 stages of the brief counselling in the correct order. So the 5 stages are assist, advice, ask, assess, or arrange. And to be honest, I won't read them out because it will just be me reading the same 5 words again and again. Question 9. So e-cigarettes, which of these is true? Are they banned in India, marketed to quit tobacco, is being used to trap the youth, available in various sizes and shapes, cause unique disease of lungs, none of the above, or all of the above? 6 minutes remaining. So question 10, which of the following medications has been proven to achieve the highest quit rate in clinical studies on smoking cessation? So A, nicotine gum, B, bupropion, C, nicotine patch, D, varenicline, or E, all of the above medications have similar quit rates. Question 11. Which of the following statements is true about smoking cessation? A, brief advice on smoking cessation provided by healthcare workers does not achieve any reduction in long-term quit rates among smokers. B, bupropion is an antidepressant that is safe to use for smoking cessation, as the associated occurrence of seizures in patients receiving the medication is only 1 in 10,000 people. C, nicotine replacement therapy is strictly contraindicated in patients with cardiovascular disease. Or D, a gradual reduction in the number of cigarettes smoked will not lead to smoking cessation. Question 12, with just under 5 minutes remaining for the quiz. Cigarettes and Other Tobacco Products Act of 2003. According to this act, all of the following are true except which? A, smoking is banned in public places. B, there is a ban on advertisements of tobacco products. C, prohibition of sale of tobacco products to and by minors. D, specified health warning labels on all tobacco products is to be put. E, the sale of tobacco products to a person under the age of 21 is a punishable offence. Or F, the sale of cigarettes and other tobacco products in an area within a radius of 100 yards of an educational institution is strictly prohibited. Question 13, which of the following statements about varenicline is true? A, varenicline reduces dopamine release in the brain. B, it has other proven uses in addition to smoking cessation. C, varenicline contains a tiny amount of nicotine. D, varenicline is both a receptor agonist and antagonist. Or E, varenicline should only be taken once daily, only at all times. Question 14, which of the following statements about bupropion is true? It does not interact with alcohol. It is known to cause severe hypotension. It is also known to lower the seizure threshold, making any pre-existing seizure conditions a contraindication to its use. It is approved for tobacco cessation. Or E, all of the above statements are true. Question 15, which of the following statements about varenicline is not true? Varenicline has no effect with alcohol. Nausea is the most common side effect. Diminish withdrawal symptoms. Sorry, I think there's a slight error there, but I think it should just say diminishes withdrawal symptoms. Disregard the and. D, reduces cravings. Or E, blocks the reinforcing effects of nicotine. Question 16 with 2 minutes and 40 seconds remaining. Which of the following statements is true? Smokers are protected from developing COVID-19. B, smoking withdrawal can last for up to a year. C, after stopping smoking, people can cough. The amount that people cough may increase temporarily. D, all of the above statements are true, or E, none of the above statements are true. Question 17. A quit coach is one who A, give lectures about tobacco harms, B, supports and motivates the patients during the quit journey, C, gives prescriptions about the medications, D, all of the above, or E, none of the above. It's just under 2 minutes remaining. Question 18. The most important requirement for successful quitting is A, willpower, B, motivation, C, commitment, D, low nicotine consumption to begin with, or E, all of the above are true. Question 19, the penultimate question. What is the most important reason for a failure to quit? A, a nagging of the spouse or any other member of the family. B, not seeking guidance by specialists. C, poor willpower. Or D, difficulty managing the cravings and withdrawals. And the final question, the only organization in India providing 360-degree care for tobacco cessation is A, IPS, B, ICS, C, ICanCaRe, or D, the World Health Organization. So those are the lists of the questions. There's only 20, and you have 45 seconds remaining. After that, we just kindly request that you fill in as many answers as you can if you haven't completed them and submit the quiz. And hopefully you've got as many questions as possible correct. And then, yeah, as mentioned before, the Facebook group is continually growing. The link to the Facebook group is in the chat, I believe. So please do go ahead and join the group. Yeah, so there's 10 seconds remaining now. So try and get in as many answers as possible. And as was mentioned before, the prizes, I believe, will be given out on the final week. So we will take all of the answers in, and that's the end of the time. So thank you very much. I will stop my video now.
Thanks, Omkar. That was really wonderful. I think everyone must have enjoyed the quiz as much as the discussion, the scientific discussion that we had. And this is for the first time that in India, such a thing has happened, that we are having a conclave or a discussion on tobacco cessation. We do have meetings and so many talks and discussions specifically on tobacco control, that is advocacy. But incorporating tobacco cessation in our day-to-day program, in our day-to-day life for every doctor is a necessity. And this is where ICanCaRe is working. We at ICanCaRe established a tobacco cessation center. I am working as the director at Max Hospital. So I established a tobacco cessation center at Max Hospital at Vaishali. And believe me, it is really working wonders. We have got patients coming from all the departments, whether it is cardiology, whether it is pulmonary, oncology, everywhere from we are getting patients, and they are being taken care. They have been followed up in a proper way. At ICanCaRe, we have got an app which has been made, and this we will just put in the link of this app. If you can put, Shruti, if you can put the link. So this app is a very informative